This is Dr. Brooke Patterson, and this lecture is on the GI system. As a nurse, you will encounter many patients who have various GI complaints and abdominal pain. It is imperative to understand the 4 quadrants of the abdomen and the underlying organs associated with each quadrant so you can narrow down the organ affected based on the patient's presentation. In this picture, you can see the 4 quadrants and how they align with the different organs. You can see that the liver is mostly in the right upper quadrant, along with the gallbladder and a section of the pancreas. You can also see that the spleen is in the left upper quadrant, along with part of the pancreas. The appendix is located in the right lower quadrant, and the only underlying structures in the left lower quadrant are the descending and sigmoid colon. This chart is a nice summary of the organs by quadrant and is another way of thinking about the anatomic locations. This question asks, the left lower quadrant contains all the following structures except A. Appendix, B. Sigmoid colon, C. Spleen, or D. Descending colon. The answer is C. Spleen. The spleen is located in the left upper quadrant. The left lower quadrant contains the descending colon and sigmoid colon. The appendix is located in the right lower quadrant. There are different types of abdominal pain, one being parietal pain. This is caused by inflammation of the peritoneum. It can be described as a steady and aching pain and is precisely located. This type of pain is typically aggravated by movement or coughing, and patients prefer to lie still. Referred pain is a little different in that it is typically felt more at a distal site. Referred pain may develop as the initial pain becomes more intense. One example of referred pain is the pain in a shoulder due to cholecystitis. Due to the long list of potential problems associated with the abdomen and the many different organs and intestines involved, a detailed health history is so important. For any type of abdominal pain, you would first want to ask all the old cart questions and determine if the pain is acute or chronic. You would then proceed to the questions regarding nausea and vomiting. If vomiting were present, you would want to ask about all the characteristics, including hematemesis, ask about indigestion, appetite changes, difficulty or pain with swallowing, food intolerances, changes in bowel habits, diarrhea or constipation, stool color or other characteristics, jaundice or fever. Our next question asks, which of the following complaints indicate the patient may have cholecystitis? Choose all that apply. A. Right upper quadrant pain, B. Nausea, C. Vomiting, or D. Fever. The answers are A. Right upper quadrant pain, B. Nausea, and C. Vomiting. The patient may not have a fever. The other symptoms are possible indications of acute cholecystitis. In order to begin our physical exam, we need to have adequate lighting, and we want to ensure our patients are well draped, supine with a pillow under their head, relaxed, and have an empty bladder. You will need your stethoscope for listening to bowel sounds and a tape measure if suspecting abdominal growth changes in terms of ascites, etc. Make sure that your hands and stethoscope are warm. When you are completing the abdominal palpation, make sure to pay attention to the patient's face and watch for signs of grimacing that may indicate pain. Upon inspection, you will observe the skin for color, any lesions, scars, and the area around the umbilicus. You will look for any bulges or asymmetry. You will note if any peristalsis is present, which are the rhythmic wave-like movements that push food down. You will stoop down and look at the abdomen from the side to see if any pulsations are present. One normal finding is a slight pulsation that may be reflective of the patient's heartbeat. These pictures demonstrate the different contours of the abdomen. Flat, scaphoid, which is many times due to malnutrition, rounded, and protuberant, which means distended when it's usually an abnormal finding. One example of a protuberant abdomen is ascites or fluid in the abdomen. The fluid could be diffused or shifted to one side. After inspection, you will proceed to auscultation. The order is very important in that you want to listen before palpation, because palpation can distort the bowel sounds. You will listen to the right lower quadrant first. This is where you will count the rate and determine if the bowel sounds are hyperactive, normoactive, or hypoactive. Normal bowel sounds range from 5 to 35 sounds or gurgles per minute. You will then move to listen to the other quadrants in a clock-like fashion. To confirm that the patient has absent bowel sounds, you must listen for a minimum of 5 minutes. Absent bowel sounds may be indicative of a paralytic ileus or obstruction. Alternatively, you may also hear a tingling sound in the case of these conditions. While we won't be covering abdominal bruits in this course, I wanted to show you the locations of the main arteries in the abdomen, specifically the aorta, which could be where the abdominal aortic aneurysm, or AAA, would be present, along with the bruit and potential pulsation. We proceed with palpation in a clockwise fashion, just like you would with auscultation. You will use light palpation, using around 3 to 4 fingers while you are palpating. Again, while palpating, be sure to observe for any signs of discomfort and/or voluntary guarding. I just wanted to show this diagram of the liver. The largest part is on the right side, but it extends into the epigastric region. The pancreas rests just under the liver and overlaps the left and right upper quadrants. For health promotion, the biggest topics for prevention and screening include alcohol abuse and misuse, risk factors for Hep A, B, and C, and screening for colon cancer. Hepatitis A is transmitted via the fecal-oral route. For prevention, there is a vaccine available, along with maintaining good hand-washing techniques. Hepatitis B is a more serious threat to health and is the type that healthcare providers are at most risk for. It is transmitted via exposure to blood, semen, and bodily fluids. There is also a vaccine available. Hepatitis C is most likely transmitted through percutaneous exposure to blood, through IV drug use, needle stick injuries, mucosal exposure, HIV infection, or birth. There is currently no vaccine available for hepatitis C. It is so important for us to promote colorectal screening for our patients. Although there are different guidelines out there, the general consensus is that screening should start at age 45. While that is the age you would normally start screening, you'd want to encourage someone with a family history of colon cancer to screen much earlier. That is also true for other screenings of this nature. Other risk factors for colon cancer include a diet high in red meat and processed meats, an elevated BMI with sedentary lifestyle, smoking, alcohol abuse, history of polyps, inflammatory bowel disease, and/or diabetes. This question asks, which infection presents the greatest risk to all healthcare professionals? A, hepatitis A, B, hepatitis B, or C, hepatitis C? The answer is B, hepatitis B. Hepatitis B poses a more serious threat to patient health in all healthcare professionals, especially individuals who are in contact with blood and other potentially infectious body fluids. And that concludes our GI lecture.